Dissociative identity disorder, DID. What is dissociative identity disorder? The mental disorder dissociative identity disorder, DID, affects many people. A person with DID has various, distinct personalities. A person's behavior is influenced by their multiple personalities at different times. Memory loss, delusions, and depression may be brought on by the illness. Past trauma is typically the root cause of DID. A DID sufferer has two or more unique identities. The person's typical personality makes up their core identity. The person's alternative selves are their alters. Some DID sufferers have as many as 100 alters. Alters frequently differ greatly from one another. The identities may differ in terms of gender, ethnicity, interests, and interactions with their environment. Symptoms: anxiety, delusions, depression, disorientation, drug or alcohol abuse, SUD, memory loss, suicidal thoughts, or self-harm. Diagnostic criteria per DSM-5, 300.14, F44.81. A. Disruption of identity characterized by two or more distinct personality states, which may be described in some cultures as an experience of possession. The disruption in identity involves marked discontinuity in sense of self and sense of agency, accompanied by related alterations in affect, behavior, consciousness, memory, perception, cognition, and/or sensory motor functioning. These signs and symptoms may be observed by others or reported by the individual. B. Recurrent gaps in the recall of everyday events, important personal information, and/or traumatic events that are inconsistent with ordinary forgetting. C. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. D. The disturbance is not a normal part of a broadly accepted cultural or religious practice. E. The symptoms are not attributable to the physiological effects of a substance, for example, blackouts or chaotic behavior during alcohol intoxication, or another medical condition, for example, complex partial seizures. Suicide risk. Over 70% of dissociative identity disorder outpatients have attempted suicide at some point. Numerous attempts and other self-destructive conduct are prevalent. When a person has amnesia for past suicidal conduct or when their present identity does not feel suicidal but is unaware that other dissociated identities do, it might be difficult to assess their risk of suicide. Treatment. Depression and anxiety are two DID symptoms that some medicines may help with. But psychotherapy is the most successful kind of treatment. You can be directed to the appropriate treatment by a medical professional with training in mental health conditions, such as a psychologist or psychiatrist. Individual, group, or family therapy can be helpful for you. Therapy focuses on identifying and working through past trauma or abuse, managing sudden behavioral changes, and merging separate identities into a single identity.